Hey everyone, I'm John Hammerly with the Plastic Surgery Channel. Its nickname is the checklist. I'm sure there's some long bureaucratic FDA title for it, but it impacts both physicians and patients. Brad, what is it?
Well, there was guidance from the FDA in November after coming out of the hearings a couple of years before, really looking at safety of implants and issues related to many aspects. And one of those was the process of an informed consent. And we talked about lots of different ways to get an informed consent. And one of the favorites of the FDA at that time was this thing that's been known now as the checklist, which has become part of the guidance from the FDA. And Bill's talked a lot about what that checklist actually involves.
Yeah, so Brad, just as you said, once we had the FDA Advisory Committee meeting in March of 2019, a lot of discussion went on after the meeting. Yes. And so it all was basically coming up to what the FDA came out with, the new labeling for breast implants. And there was initially a draft labeling, and then there was a final labeling, which was in, I think, September 2020 when that was released. But it had four things, and one was the boxed warning. The second was patient decision checklist. The third was contents of the implant, so ingredients for the implant. And then the fourth was surveillance. And so the checklist is one part of that. You know, I think that just recently the FDA has mandated the manufacturers have the new labeling on their websites and have that on their materials. And as part of that, they had the manufacturers basically ensure that surgeons were going to have the patient or give the patient an opportunity to sign or initial the checklist, and the surgeon would sign the checklist. And so that is something I think we've all implemented in our practices. You know, it's probably it's not perfect. You know, personally, I think, you know, if it was a little shorter, it would be more digestible by patients, because that's what we heard the patients saying, is they had 30 pages of informed consent documents. So it was very hard to assimilate all that. And so they wanted to have a short checklist of the main things. And so maybe at some point that will be revised, but I think everybody's integrating that into their flow.
Yeah, Brad, what do you think? Overreach?
A document ultimately has to aid the patient in making a better decision, right? And if it gets in the way of it because it's too difficult, too challenging, too long, and probably isn't completely accurate at times.
Are they hitting like, I agree, like on Apple licensing things, like, where you don't read anything?
That's what you're afraid of, right? So what I choose to do is make sure that we go through the checklist with them and they've read the checklist and they know all of those parts. But I like to decipher it down for my patients to what I think are the most important and salient parts of that in how I look at implants. And I think I would say I'm an implant expert, and I know implants extremely well, because there are points about it you don't want them to miss, and you need them to talk about that. One of the new things of the box label, which was to remind patients that, you know, implants aren't a lifetime device, and I think that's an important message to make sure my patients understand. They may need to replace them in the future, and what's the warranties on their implants, et cetera. So there are those.
Sounds like we've got more information, more safety, and better transparency.
Right.
Good triple header. Thanks a lot, you guys. If you have any more questions about the guidelines or anything else related to breast implants, this is the place to come, theplasticsurgerychannel.com.